Very much indeed. Good numbers. All right, so if the government does take over the health insurance system, if it does take it over, okay, will that kill the profits and the innovation at the big pharmaceutical companies? Our next guest says yes, it will. He is Tevi Troy, and he's from the Hudson Institute. I want to hear your argument here, because we've heard a lot about this. And the premise is that if we get Obamacare, if we get that public option, you're saying that it will reduce innovation, there'll be less new drugs coming on the market. Would you make your case, Tevi?
Sure, and thanks for having me on, Stuart. Okay, there's about $65 billion in research and development every year that the pharmaceutical companies spend. It costs about 10 years and $1 billion to get a drug approved. So it's really expensive to get these new, innovative, life-saving therapies out there. If you have a public option that rations care, that limits the amount of care that people can get, and that also limits what people can get paid back for the prices, then there's going to be less profit and less motive for them to develop these new, expensive products.
Now, a lot of these big drug companies are, in fact, based overseas. They're Swiss, or British, European, essentially. Does that make any difference?
It makes some difference, but what we've seen is that the majority of drugs have been developed in the U.S. over the last decade, and a large part of that is because of the profits that they are allowed to generate in the U.S. A lot of these countries abroad have price controls that limit the amount of profit they can get. Limiting the profits means limiting the amount of money you can put into research and development.
Now, why do you make the assumption that if you've got the public option, that will reduce profitability in the drug companies and reduce the availability of research and development dollars? What's the connection between the two?
Well, there's two things. First of all, I don't think it's just the public option that will reduce profitability. That's one aspect of it. The way that piece works is that if you have a public option and the government starts making decisions about who can get what care and how much we're willing to pay per each therapy, because this stuff is very expensive in the aggregate. If you want to limit the amount of therapies or the cost of a therapy, if let's say there's a $100,000 therapy out there and the government says, you know what, we're not going to pay for that, well, that's a problem. That already exists to some degree through Medicare, but if there's a public option, you won't have other places to look and other places to go. The other thing is President Obama is looking for significant pay-fors from the pharmaceutical industry. He just asked for and got a voluntary or so-called voluntary pledge of $80 billion over 10 years. Part of that's going to be reducing the donut hole in Medicare Part D, but a lot of that is going to be coming from cutting the amount of reimbursements that pharmaceutical companies get.
I just want you to step outside your role in the financial arena for a second and make a political judgment for me. You're in Washington, you're with the Hudson Institute, you follow these things very carefully. As things stand right now, do you think that the president will get this public option in place?
My bet right now is that a plan passes, but a public plan doesn't necessarily become part of it. I think they will have some kind of major health reform. I worry that a major health reform, with or without a public option, doesn't necessarily solve some of the big problems we're facing. It might get at the access question, the 46 million uninsured, but it may not deal with the long-term spending deficits that we're facing.
Interesting. Tevi Troy from the Hudson Institute. A pleasure, and thanks for being with us, sir.
Thanks a lot, Stuart.
Later in the program, there's